Welcome to another coMra-Therapy case report summary. My name is Garrett Murren, and today's case is on pancolitis, also known as ulcerative colitis, which is classified as an inflammatory bowel disease. This case was kindly submitted by our Slovakian representative, Ms. Jana Udinova, who's also a coMra therapist and a nurse. Before we get directly into the condition, ulcerative colitis very generally is an inflammation and open sores or ulcers in the colon. We have a male, 47 years old, who was diagnosed with ulcerative colitis in 1990, and you can see the area proctosigmoiditis indicated in red in the picture. And in 2014, during his colonoscopy checkup, it was confirmed that he has pancolitis, and you can see here in the picture on the right, this is inflammation and open sores in the entire colon. And the symptoms he experienced were severe abdominal pain and cramps during relapses, 8 to 10 out of 10. In other words, 0 is no pain, 10 is unbearable pain, so his pain levels were quite high. 12 to 14 stools of diarrhea a day during relapses, and he was averaging 3 to 4 relapses per year. There was also blood and mucus in his stool during relapses and any time that he had more than 8 stools per day. So if he went to the toilet more than 8 a day, there would be blood and mucus. And any relapse, there was fatigue and weight loss that went along with that. For treatment, the 980 home user version of the Delta was used. It was decided that he would have the best results if he could treat himself daily. He was actually set up to treat himself twice per day for a 20-day course of treatment for the first time, and after that, he'd had significant results with the first course of treatment, so after this, the treatments were reduced and modified with cooperation of therapists, and if you want more details on that, please contact us. For other therapies in the case, well, he'd been using pharmacotherapy, anti-inflammatories that are designed for the colon, and he took those orally and rectally as a suppository. So up to the start of care with coMra-Therapy, he was averaging 5 to 6 pills daily, and once he started with coMra-Therapy, no more suppositories at night, and at present he's down to 2 pills per day. Now to get more specifically into the results, this first test you see here is fecal calprotectin, which is a protein that's found in the feces, and you can use this as a non-invasive marker for ulcerative colitis because no one wants to go get colonoscopies every few months. You can see here in September 2013 the marker's at 312, and if you look at the chart on the right, this is a positive indicator of ulcerative colitis. Then at the start of care he's borderline. You can see it increased in September 2015, and then from February 2016 to present, no ulcerative colitis according to this test. And of course we'll get more into results as we go here, including the number of stools per day reduced significantly. So he averaged, before he started treatment, 5 bowel movements per day, usually diarrhea, at the start of care, and now with treatment he's down to 1 per day with no diarrhea, so well-formed stool. He's also had no relapses or pain or cramps since the start of care, and this is very significant if you consider that he started at 8 to 10 out of 10 for pain and cramps whenever he'd have a relapse. So to go from 3 to 4 a year to none for 2 years now is very significant, and the pharmacotherapy decreased significantly, and of course he's very happy about that, but he's going to tell you more about that in his own words because we have a short video from him at the end. And also I want to make sure you get that no current dietary restrictions except he doesn't drink milk. This is very significant in my opinion, and of course all of these factors together make for a much improved quality of life. So I want to thank you for taking the time to watch this case report summary. I hope it'll be of use to you or someone you know. And also a very special thank you to our Slovakian representative, Ms. Jana Udinova, who you can see here in this picture is very animated right now talking to someone. This is from our annual conference that we had in Greece in 2016. So thank you very much, Jana. And I want to leave you with this quote, everyone. The state of well-being is something that has to be experienced before one even knows that it exists. Once it has been discovered, it needs to be nurtured and tended with care. And in my opinion, coMra-Therapy is a most beautiful way to nurture and tend that sense of well-being with care. And this is from our founder of Radiant Life Technologies, Teun Merez. We'll see you next time, but don't forget to watch the video here at the end. Okay.
Volám sa Miroslav Širáň, mám 47 rokov, robím obchodného pracovníka. 7 rokmi mi bola diagnostikovaná ulcerózna colitída. V marci 2015 som začal liečbu formou coMra-Therapy. Počas liečby došlo k ústupu krčov, ústupu bolesti brucha, výrazné zredukovanie počtu stolíc, výrazné obmedzenie medikamentóznej liečby, 1/3. Komfort života určite lepší, nakoľko nie ste obmedzovaní, tým pádom zvýšená kvalita života, nie ste obmedzovaní v podstate ani nejakými zvláštnymi stravovacími návykmi, v podstate odpadla akákoľvek nejaká špeciálna alebo prísna dieta. Jediné, na čo si dávam pozor, že viac menej nepijem mlieko. Ostatné mliečne výrobky, ktoré viac menej lekári považovali za nejakého spúšťača choroby, tým pádom odpadli. Určite každý vie, že kto žije s touto chorobou, že nejaké to splánutie tejto choroby bolo zvyčajne tak, ako je pre ľudí, ktorí majú žalúdočné vredy alebo problémy so žalúdkom. Začínala buď niekedy na jar alebo na jeseň. Tieto problémy viac menej odpadli.
Ak chceš ešte niečo povedať na záver, nech sa páči.
Určite by som liečbu coMra-Therapy doporučil, nakoľko čo sa týka mňa, určite skvalitnila život, určite zlepšila zdravotný stav, nakoľko choroba je tam, kde je.
Ďakujem veľmi pekne.